So I initially started my career as a family physician. I grew up in San Diego and I did my medical training and residency in Chicago, but wanted to come home to do primary care in my hometown where I grew up. And during my 12 years in primary care, I started becoming more and more interested in procedures because I began to see patients getting instant or relatively quick responses to interventional treatments that I could do in my office setting. And one of the things over the years I noticed was this increasing need of treatment for patients with symptomatic vein disease. At the time, prior to 2000, there was very limited options for treatment that weren't kind of miserable. Most patients ended up having to go through horrible vein stripping procedures, or they were treated with medications that were sort of made in compounding pharmacies and weren't necessarily consistent from batch to batch. But around 2000 is where we started to see a lot of significant changes in the care of vein disease that became much, much better. And it became a great time to be a vein patient, but probably a better time to be a vein doctor. But the problem was, over those following 5 or 6 years, I didn't know how to get training because there wasn't any specific residency in vein disease. Most people who were doing these treatments were either vascular surgeons or some subspecialty in surgical that had gotten some kind of training somewhere. And around 2005, 2006, I became aware of the American College of Phlebology at the time. And they were having their national meeting in San Diego. I had a friend who was already in specialty for about 5 years, and he dragged me to the meeting. I took the day off work, played hooky, and went. And the keynote speaker was the national president of the organization at the time, who was based in San Diego. So she was this extremely charismatic person. Had a practice in La Jolla, not too far from where I was living. And during the meeting between speeches, I went up to her and introduced myself as a local family doctor. I told her I was starting to get interested in vein disease. I didn't even know there was a specialty. And she invited me to come watch her in her office. And it was the first time I saw a sclerotherapy treatment for spider veins, and it lit up like a Christmas tree. And I was super excited about it. And she liked my enthusiasm. And she brought me back to see her do other more interventional type treatments in the office. And after a while, she invited me to kind of join her. And I just became less and less interested in primary care and more interested in vein disease. So for a long time, my entire career, I've been in private practice, and I've enjoyed not being part of sort of the standard health system because I don't like all the red tape. And I didn't like the idea of non-physicians sort of directing my care. But what I started to recognize as the health system's evolving is it's hard to be by yourself managing all the things of a business that require patient care. And it's not just about treating veins, it's about making sure that they're adequately diagnosed, that they're getting adequate diagnostic workup with like an ultrasound or physical exam, and that they're getting help with their insurance to get coverage, because it's very difficult in the health system now to get coverage for almost anything that patients need. And the further along it's gone, the more the obstacles have become. So I was looking for a large partner that had much more national influence. And I was looking for something that was more collegial, made up of physicians like myself who understood what I was doing every day, and not someone who has not part of my specialty or even in healthcare making those decisions. And I knew several doctors who were both mentored me, and also were colleagues of mine across the country who I would talk to at meetings all the time, who had joined CVR for the same reasons. And that's sort of what got me inspired to meet the great team over there. So I'm an old trained family doctor, and I still believe that regardless of whatever your specialty is, patient care begins with a face-to-face contact of developing a history, meaning sitting and keeping your mouth shut and listening to what a patient's needs are. Why are they there? And sometimes it's not just about veins, but it's just about pain, or it's about discomfort, or it's about they don't understand why it's so hard to work anymore, or why it's so hard to sleep anymore. And so when you find that out, you come to realize that not everyone who comes in with a varicose vein cares about the varicose vein. Sometimes it's just about something else that they want managed better. And so a lot of what I do isn't just about treatment. And my priority always is being an educator first, listening to what's bothering them, educating about what it is that's bothering them, realizing that it's okay, that it's normal, that it's common, that it's not weird, and that it's manageable. And sometimes it's just managing a change in their lifestyle. Sometimes I have patients who come to me that their legs hurt because they wear stockings at night. And they just got it reversed, that they understand that if they wore it in the morning instead of in the evening, that things would be much better. And that's sometimes all they need. And sometimes they don't even realize they need something until something weird happens. And then I've been able to figure out why when they've gone to multiple doctors of other specialties and not getting the care they need. So I feel like the philosophy begins first with listening, finding out where their priorities are, what their specific goals are, and then helping them bridge that gap to getting to their goals. I have a combination of both diagnostic and surgical treatment experience. I can read ultrasound, which is not real common among most doctors, except in the vein world who take the extra time. I've gotten additional certification in diagnostic ultrasound, so I can read my own images and don't rely on anyone else to read for me. I can do 20 pull-ups. I do Spartan races. I used to be a marathoner, and then the training game became too long and arduous, so I got into mud runs. So they're shorter trail races, a lot of obstacles, forces me to do more workouts with weight training as well as aerobic exercise. So that's sort of been my passion. So my priority in my role is being an educator first, teaching them about what their problem is and helping them to decide what their options are to manage it, if any options are necessary. And that's the first role. The second role is to do what is minimally necessary to get them to their goal, to make sure they're meeting what they need without doing any more than that is necessary. And making them understand that in case of vein disease, they understand this is a chronic condition and that we can manage what we can manage and fix what we can fix until new things come. Sort of my catchphrase with patients is that vein disease is like gray hair. We can cure you the gray hair, but the new gray hair is going to come. The gray hair that gets colored never goes back. The new gray is going to come. But unlike gray hair, you're not here every month getting your roots done. But within a period of time, new things will pop up from time to time and want to nip them in the bud. We don't want to wait for things to get out of hand. What I want my patients to know about me is that I will listen first and treat second. That I want them to understand that I'm here to be their partner in their health, to meet their goals and their needs before anything else. I want my referring physicians to know that I am available to them any time of the day. When they call, they will reach me at a moment's notice unless I'm in the middle of a treatment procedure, but I will call them back immediately and make sure that whatever they need, we're going to make this as easy as possible for them so they don't have to think about it. I have a bachelor's degree from UCLA and medical training in Chicago, from Chicago Medical School. I was chief resident in my residency in family medicine in Chicago at Rush University. And then I was in private practice for 12 years in family medicine, where I was the president of our medical group, and I was a quality assurance director for Scripps Clinic. I then became in the second class of the American Board of Venous and Lymphatic Medicine's diplomat status for passing the board exam. And I've been that certification since 2009. And anybody who wants to join me in a Spartan race, y'all come and let me know.